can send them in the right direction. They're not here to sell you anything, they are here to help you understand the process. So we want you to ask questions. I guess solutions are so individual to our own persons and what resources we have, what family members are in place, who the people are around us. So it's important when you're asking questions that you talk to the experts so that they can navigate around that. Let's see. Oh, there we go. That's technology for you. Oh, today's, what we're gonna do is talk about the restrooms. I always put this up here because I'm gonna forget. The restrooms are out the door. You'll go out the door, take a left and then a right and go all the way to the restrooms. And then on your chairs, you are gonna have some materials in front of you. There should be a little notebook and a pen so you can write down your questions as I'm going through asking my questions. And if you don't have a notebook, it might be because you're on the back row. And you might wanna, if you need something to write with, feel free to reach over and grab a notebook. What you'll also have in front of you is a flyer for next month's work seminar, so you'll know more about it. It is we're gonna talk about home care and all that entails next month. So mark your calendars for that. And you'll also have a survey on your chair. These are really important because we want to know, were we able to answer some of your questions? Were we able to provide you some information that maybe you didn't have before? But we also want to know if there's something that you are curious about. As we are planning and looking for experts, who do you want to know? So please fill out your survey, as little or as much as you want, and leave those on your chairs and we'll collect those. Today is downsizing and dementia. I'm gonna ask some questions and then I'm gonna stop about 11 so that you can ask some of your questions. Okay? You ready?
Yes.
All right. Yeah. What you have, and are you sitting?
We're actually sitting.
Did you do that on purpose?
Wow.
So we have Sandy, which is a friend of mine from the Lions Club. We volunteer together and we do some eye screening together. So she's here today. Sandy will tell you more about her story when she. In fact, why don't we just go ahead and let you introduce yourselves that way? Start with Sandy.
Okay. My name's Sandy Keel, and the reason I'm here is I have a mother with Alzheimer's, and just kind of in chit-chatting with Leanne, she kind of thought it would be potentially a good idea to be able to share a story. It kind of runs in the family. I have a mom who is a retired physician, so she used to have a lot of spunk to her. So it's been a long journey.
I think she called her mama a badass.
I can't use such language in a public forum. Yeah, my mom was a badass. But yeah, so it's been difficult to see that transition, and it's kind of one of those things that touches my heart, that it's been such a difficult journey, and it takes a village. I had a village, and so if there's even one person I can help to prevent some of the issues that come along with it, I wanted to be here to help. So that's my story.
Well, hi, good morning. I'm Tara Weed. I'm from the Alzheimer's Association. I'm their public health program manager. And really our goal is just spreading education and awareness about Alzheimer's and dementia to better support our community members on whether you have a loved one with dementia, you're concerned about it in your future, or you just need tools and support as a caregiver. We have plenty of that. Happy to talk to anyone who's interested. And yeah, that's kind of my spiel.
Hi, I'm Shauna. I'm with Harmony Senior Relocation Services. We help seniors when they're downsizing and moving into a smaller home or retirement community. But as it pertains today, we help a lot of families when their parents or maybe a brother or sister is transitioning. They've often already downsized, but they're transitioning into a memory care studio. And it's a very difficult transition. There's a lot that's weighing on the minds of the families, and we're kind of helping specifically with that move so that they can focus on taking care of their parent or sibling.
Good morning, everyone. My name is Dave Holder. I'm the owner of Assisted Living Locators. I'm a senior living advisor. I help families and seniors understand what those options are: independent, assisted living, or memory care. So I'm there to create transparency so you understand and can make the best decision the first time.
Yeah, information out there, there's information online, and it can just get really overwhelming. So I just can't stress enough how important it is just to have someone in your back pocket that you can call and know that they're just not necessarily trying to sell you something. They're actually, they wanna know your story. They're gonna ask enough questions so that they could lead you in the right direction. And so that's the kind of education partners that we've partnered with, and Jana and Dave are partners of ours, and so you'll see them often when you come to our seminars because they're here to get to know you and answer those questions without you feeling a certain way. So I do want to take just a moment to say hi to Kayla and Mike and Rock in the back of the room, and I failed to introduce them, so thank you for being here. Miss Tara, will you tell us a little bit about this umbrella term of dementia?
Yeah, and it's really the best way to put it is dementia is an umbrella term. You know, some people technically may be diagnosed with dementia, but dementia is not a diagnosis. So it's an umbrella term for quite a few of different types of dementia. So you're gonna have Alzheimer's as your most common. This is a very wide range, so bear with me, but it's an estimate between 60 to 80% of dementia cases are Alzheimer's. But you'll also have different types of dementia like frontotemporal dementia, Lewy bodies dementia. You also have vascular dementia, and these are all neurological disorders that impact your brain. They're all progressive, and right now there is no cure. There are different treatments and strategies that are being used and studied to either slow the progression and reduce your risk, but right now there is no cure. And so in Indiana, there's 121 million people 65 and older with Alzheimer's. I want to add the asterisk. I said Alzheimer's and I said 65 plus. Having the statistics for all the different types of dementia right now, it's extremely difficult. And a lot of those numbers are going to be for the 65 and older population, but we are seeing different types of dementia as early as 45. And that's why it's really important to have some general knowledge of what should I be looking at, what signs and symptoms, because I also want to add, if you have memory issues or loss of concentration and you're worried about it, that doesn't mean you have dementia. It could be a vitamin imbalance. In our aging women, it could be a UTI. There's a lot of things, a thyroid disorder. So I don't want you to have these issues and then be like, well, I don't want a dementia diagnosis, an Alzheimer's diagnosis, or whatever type of dementia. So you're gonna avoid it, because it could be something that's fixed, easily preventable and fixed. So I always wanna add that. But once again, just to kind of sum it up, dementia is an umbrella term. There's quite a few different types of dementia, but those are only going to be able to be diagnosed by your doctor through multiple types of testing.
That's good. I really appreciate that. Being aware that some of these, some of what goes on in our bodies could be something other than dementia or Alzheimer's, so not being afraid. And then also, even if it does lead to that, the number of resources that are out there are just amazing. And just listening to stories, and Sandy will talk a little bit about timelines in a minute with her mom, but while it's something that does happen with us, there's just a lot of treatment, a lot of life after. So thank you for that. Mr. Dave,
Yes.
Families will often ask, how do I know when it's time? Like, how do I know when I need to start thinking about either downsizing or assisted living or memory care? How do we know when?
Yeah, it's such a great question, and I was telling Leanne before this, like, I love being a resource, and you guys have questions, please come to me, and I'm happy to answer those and spend as much time so we can talk about your specifics. So I'm going to answer these questions in very broad terms and use a wide paintbrush today. So assisted living, we'll start there. This is all residential living. None of what we're talking about today is a nursing home, as you might think. So this is your own apartment with a nursing staff to help with activities of daily living, bathing, dressing, toileting. So they're there to provide support so the residents can stay independent, right? So you can have dementia and be in independent living or in assisted living, that's okay, right? As long as you're able to be redirected, you can participate at your own level in activities, there's not confusion, you can do quite well in assisted living. Is that
Yeah.
good? So
Yeah.
I'm on the right track?
Yeah, you're on the right track. Yeah.
So You know, it's just a matter of, I think, thinking about your own situation, and they're designed to have activities, they're designed to provide that support. What are those benchmarks that you're looking for? Is it gonna be when that physical care is too much and you need to make that move? Is it more of the cognitive impairment is beginning to get too much in the home and now you need to make that move? They're all designed to support with that. It's just a matter of also understanding the philosophy is to keep you independent or to keep your loved one independent. So I think most people wait too long and then they can't, you know, be in that supportive environment. They can only participate in 30% of the activities are there. So it's what your needs are and understanding maybe what those benchmarks are. Is that
Yeah.
kind of?
Yeah, and then there's another thing that I feel like I've been learning from you is that that the longer that we make, it's such a balance, right? Because you want to stay in your home as long as possible, or your independent living situation as long as possible, but then not waiting so long that it's difficult to make a healthy adjustment. Does that make sense? Do you get it? So it's and then how do we know? I think that's the $1 million question, right? Is how do you know when you're at the edge? You're like, okay, I don't want to wait too long for that next transition because I don't want it to be tough emotionally on me.
Yeah.
Stressful. I guess stressful is a better word.
Yeah, I think ask yourself, you know, what is it that it's so difficult, you know, the caregiver's health declines by 67% when taking care of someone with dementia. So the caregivers are part of this equation too, right? We don't want the situation where their health declines and now they can't take care of their loved one and now they don't know where to go or what to do and they don't have a plan. So the fact that you guys are here and you're learning about this and you're being proactive is awesome because not everybody does. My family didn't. That's why I do what I do. So.
Thank you. I guess I just want to ask you real quick, does that help? I feel like that was a really wide answer. It depends. It depends on your safety. It depends on, making a move. But does it answer your question about yes, thank you, John.
I just
Or
wonder,
Jim, yeah.
how do you determine whether a person should go to independent living or assisted living?
Yeah, so that's a great question. And really, independent living, the difference between that, it's still gonna be the same residential environment. It's still gonna have maybe a meal plan, help with housekeeping, things like that. So it's maintenance-free living. The difference is there's not gonna be a nursing staff there to either respond or to help or to just react, because the assumption is you're independent, right? So that's what I would kind of focus in on, is my loved one able to make those decisions on their own, or do they just need a little bit of support? Assisted living communities will have people that work in them. They still drive, they can still do that. They might just be there because their medication, they just want somebody to help them manage their medication. So they get that support, they get 3 meals a day, and they can go do whatever they want. I think today's topic being dementia, it's that cognitive ability. One of the things I ask is, would they know to push a pendant if they needed help, right? If they don't know that, or they don't know if they walked out, would they find their way back? Maybe assisted living might be the better, because you'll have a little bit more structure, you'll have a little bit more routine, you'll have a lot more eyes on you. That might be leaning towards assisted living.
Okay. Thank you.
Yeah.
I have a
that's
question
good.
too, in reference to independent care and assisted living. If you are in independent care, obviously you can live with your partner.
Absolutely, yeah.
In assisted living, can you stay with your partner
Yeah.
but not in memory care once it gets to that point?
Again, yeah, Judy, there's some nuances with that. Probably if you didn't have a diagnosis or you weren't that, it's a little tougher environment to be in that, but in some instances you can.
But in assisted living and assisted living, like you were talking about home care people, like the caregiver, I mean, obviously it's a lot more work unless you have somebody there 24 hours. When you're in assisted living, is the person who is not ill free to come and go? Is somebody always going to be there to?
Absolutely, yeah. So you'll put together what's known as a care plan, and when you move into assisted living, they do an assessment to determine what we're gonna be helping with. And so if that your spouse or your partner doesn't have a care level, that's okay. So yeah, there's no restrictions as far as that goes. Not everywhere do you have to have a care level.
I mean, like if you wanted to leave, you don't want your spouse to walk out of the house while you're gone.
Mhm.
I mean, it sounds like a babysitter. Can you call somebody and say, hey, I'm gonna be gone for 2 hours? Are you gonna come and take care of, are you gonna watch them? How does that work?
Well,
You
so
could actually, there's different levels of providers, so someone could come in and help you for those occasions, yeah.
yeah, it's not one-on-one care by any
Right,
means,
right.
but yeah, but like, you know, they'll get their medication at this time, or they can come get them for meals, or bring them to activities while you're gone. That's all part of what you would establish, absolutely.
And that's a helpful way to actually extend that care when they're in that assisted living. Maybe you're not wanting to make a move yet, or they don't have to move to that memory care, just to supplement that type of service. So
Right.
I have girlfriends that are in the same community with their husbands. I have some that are in apartments nearby. It depends on their resources.
I wanna throw a little bit of an angle to that. What if you use an assisted living place for respite only?
Mhm.
So it's assisted living, but, okay, so the experience I've gone through is, it's assisted living, so I'm thinking, okay, they're gonna bathe her, you know, the only thing pretty much that they do is they manage her medications.
Right.
So,
So respite, what that is, that's an assisted living apartment that's already furnished.
yeah.
And so you could, you know, maybe come out of rehab, you're maybe not safe to go home, or you just wanna try it. Most of those are month-to-month leases, you can set that up, the apartment's furnished, you get your meals. You still have to follow the same requirements with the licensing, because it's gonna be a licensed assisted living. So you would still have a care plan, whatever that is. But you also have access to PT and OT that's in the community to kind of keep that rehab and get their strength up and build a little routine. Is that?
So they should be kinda sorta giving the same kind of services if they were living there.
Absolutely, yeah. Now, they are just living there, but maybe just a month at a time. Yeah,
Temporary
Temporary, yeah.
situation until
Because
they
we
can
run into an
either
issue
go back
where,
home or gives the family time to get them moved into a new place. We just helped a lady last week. She had been living in respite care for about a month since she had gotten out of the hospital and realized she wasn't gonna be able to go home and live independently. And we were able to get her moved into an apartment at that same community, where she'll be living with more assistance. But just like you said, she was having access to all of her physical therapy, occupational therapy on site, so that she's not having to drive back and forth and live on her own. But it is more of a temporary arrangement.
Respite care, yeah. Yeah, one more? Yeah, one more, yeah.
If someone or a couple is living in a bigger facility, like a Hoosier Village that has the multi-tier, and they are in independent, is it possible to do those a la carte services occasionally for help or assistance? Or do they normally like, nope, you're independent, you can pay for a meal plan potentially, but that's about it, or?
I would say, again, painting a broad brush, when you're independent, you can bring in any services that you want to support that, to keep you independent longer. Now specifically Hoosier Village, I know they've got restrictions on who can and can't come on the campus, so that might be a hurdle that you have to jump. But even in assisted living, if you're like, hey, mom's had a caregiver, the same one for a year, we want to make sure that she can still come into the community because they have that relationship. I don't know that any would say no to that, so yeah.
And just to clarify, just in case, it's not gonna be the community's nursing staff.
Right.
It would be kind of your own
Your own.
independent, private pay,
Yeah.
service that you would bring in. But
And-
usually they're they want that because they want
Yeah.
you to be able, anyone to stay as independent as they're capable in whatever support they might need.
That's good. That's a very good question, because I appreciate that Jonna just pointed out that the community may offer some services, but we meet people, Rock and I do some networking with some other organizations that I'm like, oh, you do that. Like, you go in and help with money management, or you go in and just help with medication, or go in and help with the housework, or, so there are services that will help people do whatever they need to do
What if you have
Within the
long-term care
program.
insurance?
Pardon me?
What if you have long-term care insurance and you wanna bring somebody from that group in to help you out temporarily or whatever? Do you get to choose that person, or is Hoosier Village gonna say, well, we have to vet them, we have to see if they're okay?
I
Yeah.
don't think Hoosier Village is gonna vet them when it
Oh,
comes to
that was,
your
I meant any,
insurance.
like nursing homes, okay, one specific, but would they have to approve that person, or would you be able to choose someone? I mean, you're paying for the insurance, so
Yeah.
how does that work?
Sorry, like, that you would have that, yeah, Hoosier Village doesn't work with people like me. Short,
mean, in
stocky
general,
guys.
in
You have to be
nursing
6 foot to go to Hoosier Village, so no short, stocky white guys. My experience with Hoosier Village, when I've been there, I had that situation, and they said, we have to see who that is and know who's coming on our campus. Other campuses, yes, you can bring whoever you want in to provide that care, and you have that right to do that. But I would address that with Hoosier Village to
Yeah,
understand
and this,
that.
I didn't specifically mean to bring, I just meant, you had mentioned, but it just, I mean, in general, with
Yeah, in general, yeah.
senior facilities,
Absolutely.
who would make that choice?
And it really depends on the type of long-term care insurance that you have. If you're, working with an indemnity type of policy, they'll pay you a fixed amount, and you can use that money for whatever services you wanna have. If you're, submitting receipts back in as part of that, again, you still have a lot of flexibility with that,
But I was wondering if the person that you choose to bring in,
Yeah.
will they accept that?
That's a good question. A good question to maybe ask, as you're shopping around, as you're looking for, a community. Yeah. I wanna talk a little bit about, just navigating this whole process with family. It's not just an individual, that goes through this process, it does involve the family. So Tara, can you speak to that a little bit about, the entire family system, and maybe even what, the Alzheimer's organization can help with?
Yeah, and we also look at it as, not just family, it's a support system. Not everyone has family members they feel like they can rely on or trust for these issues, so it's really looking at your support system. Who do you feel like is comfortable to have these discussions with? And that's kind of who we're gonna focus on, because these are not always easy decisions, even if you have planning ahead of time. I can even bring it personally. My grandmother-in-law is going to assisted living. She has 1 local child and 2 out of state. The 2 out of state don't really see how quickly she's progressing and have been pushing back a lot. And so you sometimes have to really manage that conflict that's gonna come from different perspectives of how fast is somebody progressing, should they go to assisted living, what kind of care they're going to have. And really, the best way to go forward with that is just trying to have as open communication as possible. And also having, try not to be too much my age, but just having the proof and having the evidence of, okay, they're exhibiting these signs, I can provide this level of support, I can't help them from being a wandering risk. So we need to look at assisted living. And so it's having those conversations, knowing your limits as well, that's gonna be super important, managing those family dynamics, because once again, like I said, this is not an easy process. But bringing in the support system, but at the core, the person who's in the center of it, the person who is going to assisted living or memory care, they should still be at the center. Even if they've progressed far with dementia or Alzheimer's or whatever type of dementia they may have, you really wanna still keep that person at the center. What's going to work best for them? What kind of things can we incorporate into this decision making to make this as seamless as possible? If they prioritize certain types of, activities or luxuries within your limit, within the limit of, finance and all of that, you still wanna keep the person who has dementia at the core of all this decision making process. Because we don't wanna take away their autonomy if they still have that. They still have the ability to make those decisions and be a part of that decision making process. But open communication is the best we can do, trying to be as knowledgeable of the options, easier said than done. There's so many, but there is a lot of resources here through the Alzheimer's, through the 24/7 helpline, where you can ask any question from what is Alzheimer's to what kind of financial planning should I look at. It's just trying to get all your ducks in a row as soon as possible so that you can keep, the decision making as a group, having that open dialogue and trying to minimize conflict. But once again, at the end of the day, it's not easy. This is a hard decision. Depending on where somebody is, on the kind of the dementia spectrum, so.
Okay. Any resources that would help someone, like a daughter or a son or niece or nephew to understand, like, maybe they're younger and they, just to help improve their perspective of dementia or Alzheimer's?
Well, I mean, so through the Alzheimer's Association, we have quite a few different trainings. Not only do we have general what is Alzheimer's, it goes a little bit more in depth to Alzheimer's, the different dementias, but we also have a 5-part series called the Empowered Caregiver. What it goes through is just kind of trying to strengthen anyone who's involved in the care-making decisions. You do not have to be a 24/7 caregiver. If you're providing emotional support, if you're providing financial support, if you're providing 12 hours of caregiving for a family member, you're considered a caregiver. And these are tools that you can use. So we have like supporting independence, responding to dementia behaviors, exploring support and services, so you can have that general information of what's available, what should I be looking for to kind of help you navigate what's in the community as well. But I'm also always going to suggest our community partners. I know a lot about Alzheimer's and dementia. I'm not an expert on elder law. We go to our elder law friends, you know? I'm not the expert on assisted living. I've worked in assisted living, I have personal experiences navigating it, but I'm not gonna know everything. Suggest Dave. And so that's one of the best parts about going to these events, learning more about things in your community. But there are also things on like 211 through the Indiana, the Alzheimer's Association helpline. We do recommend partners in your area. Also we'll recommend resources. And so there's a lot out there. It's scary to find. You know, SOCOA is the local area and aging would also recommend them. They have a great, you know, kind of helpline is the only way I can describe it, but a great number you can call and just ask questions. You know, it's really just seeking what's in your community and seeking those partnerships to kind of find what's available and just getting as much education as possible. A lot of it is available online as well through modules, so you don't have to go in person for some of these education as well.
Dementia Friends is another organization that I've participated in, and my dad as well. They do kind of small workshops at different times, and it might just be 5 or 6 people like yourselves. My dad happened to be visiting me. His wife was experiencing some early signs of dementia, and he had come up to visit, and I was going to be participating as kind of part of my job, not participating, but attending as part of my job. And I encouraged my dad to come with me, which kind of surprised me that he did. And it's just a great workshop that kind of focuses on the caregivers and the people living with and kind of around people who are struggling with dementia. They give you a lot of insights, tips, recommendations on just simple things on how to navigate day-to-day interactions. Also kind of making you aware of kind of some signs and symptoms of things. And it was a great conversation starter afterwards for my dad and I, because we just kind of went through later that list, and he's like, well, yeah, she does that, and she does that, and I wondered why she was doing this. And it was just like this kind of awareness. He was just sometimes chalking it up to maybe she's just being difficult or ornery or just getting old, but it's like, oh, okay, well, there's an underlying condition here that's prompting some of these actions by her. And so again, Dementia Friends is just a great, just kind of like a first step just to kind of get educated a little bit about some simple things.
Yeah, and they do both memory cafes, which can be activities for you and your loved one with dementia to do with a group. They also have Living Well with Dementia events, where it is somebody who has a type of dementia and their caregiver. There's a little bit of education at the beginning, and they kind of just speak about their experience as well. Also, Ascension St. Vincent's does I would say like a 6-hour dementia seminar once a month on Saturdays. I've heard, you know, really great things about it. So would also recommend that as well.
Thank you
Yeah,
for
I
those
think
resources.
our partner Centerwell's been having monthly events at the College Park location too. They're not here today, but.
Yeah, so they've been doing a lot of the memory cafes as well at Lafayette Road as well too in Indianapolis.
There's somebody here locally in Zionsville, her name's Jessie Hillock. She's the owner of the Memory Compass, and she's like a dementia navigator and coach. So she can do a lot of that, work with you one-on-one, help understand what the progression is specifically for your situation. She's tremendous.
Yeah, thank you for that. It's There was a survey done in the spring that said, less than 37% of people knew where their resources were. So that just inspired us even to continue to have these seminars so that we can continue to expose our tribe of the resources that are available to you.
Hi, Mary. Hi. Can Dave tell me again what Jessie is?
Hillock, her company's called The Memory Compass.
I have a question for Jonna, but I think I'd like to ask Sandy, because Jonna helps with our families that are transitioning. But I would like Sandy to tell us a little bit about her experience as a daughter.
Well, excuse me, I thought that you guys are all here because one of the biggest things is planning ahead. And fortunately, I don't know which way you'd want to look at it, is that my mom was so intelligent that she was great at hiding the fact that she had dementia. Oh, I didn't hear you. Oh, what'd you say? Oh, I didn't understand you. A lot of that. And so her husband kind of wanted to put his head in the sand and kind of ignore it, because with my mom being such a strong personality, she kind of ruled the roost. And so there was a fine line between being stubborn, maintaining your independence, and denial. So balancing all of those, we had to do everything in crisis mode, and that's why it was really nice that we had the village to help us. And I can tell you that the one thing that really helped is that my mom loved and trusted me. And so I one time said something to her about that I thought her memory was having a little issues, because her father did as well. And she point blank looked at me and said, "I don't believe you." I'm like, oh God, this is gonna be hard. Several months later then, we went into the crisis mode, and thank God she had trusted me enough that we got our power of attorney and healthcare power of attorney in place early. Because with her denial and wanting very understandably to live independent, how did you do anything? And so by the time we did do something, it would have been too late to have been able to legally appropriately gotten the power of attorney and healthcare power of attorney in place. And had we not had those, I would have been up a creek. Because she could have gone into the bank and done whatever and destroyed her finances or whatever, because legally she could. So we had all that in place so that when crisis mode hit, I could help to get her placed into a memory care unit. And the other thing is, her journey was so delayed in getting her placed appropriately that her specific situation is that it made her absolutely psychotic. So she went from just being confused and things to psychotic. It was not pleasant for anyone. And so getting things done early and appropriately is so much better for everyone. And I know it prompts very difficult conversations. And like I said with my mom, I confronted her and she just said, "You're lying," or "I don't believe you." I mean, sorry. And it was hard, but luckily, since she did love and trust me, by the time I said Mom, there was some other side issues. Her husband probably had frontal temporal lobe dementia and was like sending money off, getting scammed a little bit. And so I was able to basically say, "Mom, I need to protect your finances." And then she believed me, so we got things in place. It was rough though. And so I would encourage you to have those conversations as your journey is gonna be different, everybody's is different, but to get things in place as early as possible, because that way maybe you can go to the assisted living and age in place and transition of care, and it maybe will go more smoothly. So again, everybody's journey is different, but oh my goodness, get your healthcare power of attorney and your power of attorney in place early as possible, that they'll allow you. Because obviously you can't do a power of attorney until they're ready to allow you to take things over, but then it's in place when you need it. Because every time I've tried to say anything to anyone, they're like, "Well, I can't talk to you." I'm like, "Well, here's the paper." And even when you have that paper, they're gonna say, "Well, we want our lawyers to approve it and look at it." And so it's not like you immediately have action just because you have the power of attorney. So there's extra hoops to jump through. And the other thing that I almost forgot that was really important is to have that diagnosis somewhere from a neurologist, primary care, or something that helps to say, "Well, here's the power of attorney and I'm using it because here's her piece of paper that says she has dementia." And without those, I'd have been up a creek. So everything they're saying, I agree with, and I'm like wholeheartedly agree with, but boy, did I need those pieces of paper to make it things.
So once you
activated your power of attorney status, did you have to like present that to her bank, like beforehand, so that they could put kind of a hold on her access to funds?
Well,
I mean,
again, everybody's journey is gonna be different, and that's one of those things, I don't know legally what they can and cannot do, but she was not able to come into the bank, but by that time, and I had the good fortune of that the bank knew her, cause she'd been going there for so many years, and they had noticed she was declining. So legally, I'm not qualified to say, don't know, but I know that the bank we worked with, when I told them that was going on, they're like, okay, we'll put a note on her account and call me. That never had to happen, and again, I don't know legally what is right with that, but that was my experience, that I had a bank that worked with me.
Yeah, that level of detail, you probably would need to talk to a specific basis.
and did you find when she transitioned to memory care, did you notice a bigger decline because of the transition? Like, that's gonna happen whether you try to be ahead of the curve or you do it in crisis mode, it's just would you say you expect a drop in cognitive ability?
Hers was precipitous. That's why I said she went outright psychotic. But you could even see a difference in her that, so what happened is her husband had a stroke, and since we had done so many things proactively ahead of time, that they were like, no, we're staying home, we're not moving. We at least had a lot of things in place. Then her husband had a stroke. We got her into a memory care unit 1 week later. But while we're doing that, we also knew we needed to act quickly to get the house in order and sold. And this part, I don't mean it being manipulative, but we knew that her husband would want to like, well, maybe we should go back home and try again. But he had agreed, go ahead and sell the house, so we're like, we are hopping on this so that he won't change his mind, and I don't mean that manipulative, it was done out of love. So there's so much commotion going on around her, she was already starting to hallucinate a little bit. Then when we put her, and again, this is her journey, everybody's gonna be different. For her, then when she got into the unit, she went so psychotic, she had to be diverted to a psych hospital for about a month. Maybe not quite that long, but she was on no medications whatsoever to start with. But again, she was a physician, she's fine, she knows how to take care of herself, so that was that stubborn denial part of her as a physician. But once she got on medications, it helped her very well, and now she's on like only one medication. So she's doing great now, but that abrupt change was very difficult for her. So had we been able to go a little more slowly, maybe it would have been the same outcome for her, or maybe not. No,
There was a lot going on for anyone.
There was a lot.
Yeah.
A lot.
And I can add a little bit as well of any big transition is going to be hard. There may be increased confusion, there may be increased agitation, which can increase other, unfavorable behaviors, to phrase it. But what really is going to make a difference is having a strong support system in whatever environment she's at, and also keeping up some familiar habits, keeping some familiar items. So, sometimes, unfortunately, people are transferred from their bed to a hospital bed. But ways to kind of help ease that transition is just using the same blankets. Having similar scents as well is really, really powerful and can trigger different things in your brain. So it's trying to have a strong support system and also bringing some of those familiar comforts of home. I mean, how many people when they travel bring their own blanket or their own pillow? I hate hotel pillows. I always bring my own. It's a little bit of that comfort of home, and that's something that can be helpful when changing from environments as well. But also if she's doing a certain activity or having a certain level of interaction from, independent living to assisted living to memory care, if it's possible to keep that level of, involvement that she has, whether it's brain activities, that's important because we hear it in a lot of different situations. If you don't use it, you lose it. But we also really see that with our dementia patients. I've talked with people who've had dementia or another progressive disease of where sometimes you fall into depression and it's hard to have those habits. And so they started to lose it. There's a woman who does the Living Well with Dementia events, and she would talk about how she just stopped talking and she started to lose that ability. And luckily she was able to, with a lot of work on her own self, she's pretty close back to where she was. She can write her own name again, she can speak, although sometimes she has to, repeat herself and things like that, but if you don't use it, you lose it. And so that's what we sometimes see with that transition to memory care, and this is a personal opinion I've seen from working in assisted living, is they just go to memory care and then they don't do any of the activities or the engagements that they had. And so it can look like that progression is increasing from that transfer of environments, but it could be that transfer of engagement and level of brain activity that they're using.
That's a great point.
I will just might add that, kind of tag onto that, one of the things that we did for my mom, and we had, you know, again, part of our village helping, is that they took her dresser and took a picture of what was around, you know, like, so they knew how to set it up. And so her bedroom was kind of set up as much as her home as possible to kind of make it feel like home. And you could tell, you know, again, after her abrupt problem, you could tell that gave her comfort because she'd see the pictures and it was familiar, and so she had those things to give her comfort so that she still felt like taken care of. Granted, she was still confused and it took a while, but, you know, it took probably 4 or 5 months and with lots of ups and downs, and then she'd still have a day here and there. But the first 4 or 5 months, there was lots more ups and downs, and then it's just been more of a calm, slow type thing. But I think having the pictures and things just from her home really helped.
Yeah, this is getting into Jana's expertise. This
Yeah,
is where,
sorry.
you know, no, it's good.
That's
But this is
perfect.
where like someone like me who's just sort of, you know, pulling together the team of people that's gonna help people get from where they are now to where they want to be. Obviously Dave, I would be my first call, but then Jana is going to help. She's the expert at making that transition, that physical transition. Can you tell us a little bit about that?
Sure, what Sarah had said, focusing specifically at the time and in the situations where, you know, dementia is the trigger for the transition, whether the individual is coming from their home or maybe they've already been in assisted living and it's the diagnosis has progressed more and they need to transition to memory care. Families handle it in different ways, again, depending on the situation, but in many cases, I just helped a son and daughter with this last week, and a lot of times it's a lot less stressful, and this goes back to your point, keeping that individual at the center and what's best for them. A lot of times the stress of the idea of moving is just too much for the individual to handle, and I've had a lot of families ask me to come in. We're gonna take Dad out to breakfast and then we're gonna go visit some people. Can you get him moved while we're gone? And then they just bring them into the new apartment or the new room that is set up to look like, you know, to recreate their environment. And a lot of families in that particular scenario stress a lot about it because they feel like it's a little bit manipulative or they haven't been truly forthcoming, but it truly is coming from love and safety. And I remind sons and daughters of that. You are coming from love and safety, and what's going to be less stressful for your parent or for your brother or sister. And we can do that for them. I had a client who asked us, their mom was moving, in this case, she was having to move out of her townhome. They knew it was going to be very difficult for us, and they were leaving for breakfast, but they're like, you've got to keep the moving trucks, y'all got to park over at UPS or something, because if she even sees a moving truck on the street or loitering around the neighborhood, her antenna is going to go up. So we were parked at the UPS until we got the all clear that they had left, and we can do those moves, because with dementia and transitioning into something like a memory care, you're not taking a lot of things. You're taking important, memorable things, but you're not taking a lot of clutter, a lot of unnecessary things. So.
And how are they doing afterwards, like after those types of moves? Or do you have moves where they're actually part of the planning as well?
We do have moves where they're part of the planning
'Cause
as well.
You've got clients you've moved several times, like as
Yeah, and I guess I was speaking specifically as it relates to dementia, the dementia diagnosis. And there have been moves. We helped a lady recently who was moving out of her home, very resistant with her daughters about it, but had kind of let them I guess, make the final decision. And she was involved, but, the daughters were also there kind of, saying, we're not taking all this stuff, we can't take all of this stuff. So it just, you know, you have to keep that individual, again, at the center and do what is, gonna work in that situation. But we did get her moved all in one day, we got it, you know, kind of all set up for her. In some cases, depending on the severity of the dementia, sometimes the community will suggest to the family, don't come back for a week. We need a week to get them established into a new routine. If you're coming every afternoon, they're gonna be asking you, take me home. When are we going home? Come get me. My daughter's coming to get me. And so sometimes they'll ask, give us a week to just let her get settled into, you know, a new environment. There's been other situations where the family has worried about it. We've moved someone from assisted living into a memory care. The mom's walked into the room, she's like, oh, this is a lovely room. Oh, I like this room. And a lot of the stress that they were worried about just kind of got lost in the kind of that forgetfulness of dementia. So it varies.
Yeah, and I also want to add the idea of, you know, you hear a lot of people asking to go home. And sometimes depending on the progression of dementia, you want to just talk with your loved one, because home may not be the home they lived in a year ago. Home could be the home they lived in when they were 20. You know, sometimes with different types of dementia, their reality is not always current. When I worked with dementia patients as well, I was somebody's secretary for an hour. He thought I was his secretary. He told me to grab him some papers and pens, so I did. Redirected him, told him I was gonna get it for him, and so forth, but you never know exactly what reality somebody's in as well. I always wanna kind of add that caveat, so when someone's asking for home, even if you brought them home, it may not be the home that they thought they were going to. But that once again, it's just working through that progression, you know, working on managing those behaviors, knowing how to manage those behaviors is also really important, because once again, like we kind of mentioned earlier, is that sometimes that transition can, you know, increase confusion and agitation. So having just some coping skills and redirection skills for that is going to be important when navigating those transitions as well.
How long do you pretend you're the secretary? I mean, do you like maybe just that time and then you leave and then you come back and then you're like, hi?
And so when we're working with caregivers on how to manage those behaviors, the way I like to phrase it is not my right to ruin somebody's reality and to change it. I'm going to respect what reality they are in. If it is an unsafe reality, that's a different conversation. But what I did with him was I was like, okay, fake name Jim, I'm gonna go get your papers and pens. Why don't you head down to lunch and I'll meet you there. When he came back, he was perfectly fine. He didn't think I was his secretary anymore. He needed that redirection to kind of clear his brain, focus on something else. That's gonna be different depending on where somebody is on their progression. But once again, I always view it as it's not my right to break someone's reality. And as long as it is not hurting anybody, because what can happen is the sky's purple. The sky's purple, right? Everyone knows the sky's purple. If I told someone that seriously, how are they gonna react? They're gonna get defensive. They're gonna be like, what do you mean the sky's purple? It's obviously blue. That can cause argument, that can cause agitation. And so sometimes when you break that reality, it can cause some of those behaviors that are maybe difficult for, you know, non-medical professional caregivers to deal with.
So like my husband sometimes will be like, well, when you move that, and I'm like, I didn't move it. So maybe I should say, oh yeah, when I moved it. You know?
And you don't even have to 100% agree or disagree. You just be like, yeah, it moved, and then change the conversation, go about your day. You don't always have to 100% feed into it, but once again, sometimes breaking that reality is what can lead to those behaviors that cause a lot of stigma for Alzheimer's.
Yeah, I understand.
I know I found myself playing bobblehead a lot. Excuse me, because it's very true, because your human nature in the beginning is you want to correct what they're saying.
Yeah.
But you can't correct it, you do have to live in their reality, and sometimes it's tricky, because we for a little while, my mom couldn't do it now, but she used to have like one of those echo shows that she could call, and I don't know if it was a good thing or not, you know, but anyway, she called me one time, sorry, I'll give a 10-second really funny, it's funny, if you don't laugh, you're gonna cry. She called me and she's like, well, what are we gonna do about this baby? And I thought, oh my God, how do I live in that reality? And it's like, she had been watching TV and had heard a baby cry, and so her reality and distortion turned into that there was a baby there they needed to take care of. But that was a difficult one to kind of go with the flow, because I was like, oh my God, what do I say to this? But you just live in their reality, and it does seem to keep, from my experience from my mom, it kept her calmer as opposed to when I tried to correct her. But that was my human nature, because I'm kind of a bullheaded person too, that's not right, Mom, that, you
Well, I just
know,
wanna
wanted to
help them,
correct.
like, be right, but I guess
Yeah.
you don't
Yeah.
help them be right.
Yeah.
And it's hard. I mean, my grandmother this past weekend was like, "Where'd you get that baby from?" I'm like, "What do you
Another baby.
mean? Where'd you get this baby?" Well, yeah. I was like, "This is my baby." You know, I wanted to be like, "I didn't steal this baby." Like her phrasing was almost like, "Where'd you steal this baby from?" And I was like, you know, I basically just had to just be like, you know, she's my baby, and just I walked away because honestly, like it wasn't, you know, a difficult conversation. She wasn't actually accusing me of stealing a baby. And she was perfectly fine. She got her answer. I walked away and redirected. She asked me that question again in 10 minutes. Yeah. That I answered pretty much the same. Yeah. But at the end of the day, it didn't hurt anyone.
Yeah, just another example of just not kind of living in their reality without also, I'll just tell you the story of this client that we just recently moved. She didn't want to move, and her husband had died about 6 months ago, and I was there in the apartment with her, and she's like, "Where is Jim? I don't know what they've done with Jim. Where is he?" Well, I knew where he was, but you know, I just like, well, I don't know. We need to ask Kristen. Like, let's maybe just ask Kristen about that, and then just, you know, tried to redirect. So it didn't require an answer. She was satisfied with the fact that I didn't know where he was, but that was just kind of letting her live in that reality, because, you know, she didn't need to know the truth in that moment.
And
I-
plus it keeps you calm. See, I would have never addressed
Yeah,
that.
keeping calm,
Yeah,
yeah.
I'm like, you know, I have to try to correct and get you on the real reality. I wanna tell you what reality is.
I got
But you
told
don't.
one
You
time
just
to
kinda-
wipe the expressions, don't you remember, or I already told you, because they go into repeat mode and it's, you can't help but being frustrated and you wanna say, well, I already told. You just go with the flow and just go, yeah, and again, the bobblehead.
Yeah, but when you were telling me your story, Sandy, I felt like you shared that you just tried to use a lot of humor, and not at, you know, your mom,
Like
just
expense. Yeah.
not at their expense, and not to make them feel in a certain way, but you just almost seemed like you just tried to enjoy the process and just enjoy it.
Yeah,
Laugh.
that's why I said, if you don't laugh, you're gonna cry, so some of the silly stuff, like the baby story, you know, you just have to go with them, and again, bobblehead, and try to tell them stories that might make them laugh. If it keys a memory, maybe that's great, but if it doesn't, you at least enjoyed the story. I mean, it's a difficult journey, lots of ups and downs, so.
So I mentioned if a friend's gonna call me and ask questions about where to go, how to go, what's that look like, I'm gonna call Dave. So Dave, I think that maybe someone I know needs to move, a family member needs to move, but I don't really know what resources, what they need, where to go. I don't know about their financial situation. How does it work? Like, how do you help us?
Yeah, so I'm really there to help you navigate this world and understand that, like I said earlier, so you can make the best decision. So we're gonna spend time learning as much as we can about your situation. I'm a little like a realtor in that regard. So location, budget, but what are the care needs? What's important to the family? What are the long-term goals? I'm gonna learn all of those things, and then based on that, I'm gonna provide some options. And that's where I share all of my notes that are very detailed with a lot of information, so we can have those conversations. If I seem like I check the most boxes for you and that makes sense, then I'll set up the tours. So I go there with you. So I kind of wear that advisor advocate hat to kind of ask those questions. It's always gonna be your decision. I'm not here to talk anybody into anything or create a false sense of urgency or anything like that. But I'm really there to help you make the best decision that you can at that time, whatever that is. So That's
Yeah.
essentially it.
Can you
yeah.
just share with us how you're compensated?
Yeah, so I'm compensated by the community, so there's no cost to work with me, you don't pay more. Again, kind of using that realtor analogy, you go to buy a house, the seller is gonna pay that referral fee, so it's the same with the communities. I think I am very objective about that, cause I will tell you, yeah, I know that's in your budget and in your neighborhood, but, they're on their third executive director in the last 12 months, so we can go there, but we better go there with eyes wide open, so, yeah.
So that you're fully informed.
Yeah.
Like if
Yeah.
that fits in your budget, but you go into it knowing that there's that hiccup there,
Yeah.
then your expectations are guided accordingly.
Can I add one thing, kind of what
Yeah.
we've been talking about a little bit? Somebody mentioned this, and I'm gonna eventually just steal it and say I thought of this, but I didn't. As this process, you guys are all here, so you guys are learning, and you are being proactive, and this is awesome. So much about getting older or caring for a loved one is about that emotional part of it, right? I look in the mirror every morning like, who is that dude, man? I can't do everything that I used to do, right? It's hard to get older, and it's harder, especially with dementia, to see someone go through that change. It's all very emotionally based, right? And making a move like this is all very emotionally based. But you've got to align your head and your heart, and you've got to be able to intellectualize that, right? So maybe as an example, I love my records, I love my CDs, they're all filled in my basement. I spend a lot of time doing that. God forbid if I ever get dementia or I can't do that, I don't want my wife looking for a place with a 1-bedroom and a den because of my records. I might not understand that that's what that music comes from, or I might not understand how to put that record on the turntable or pop that CD in there. But Spotify might be a solution that's gonna keep me calm and do that. So yes, we wanna find what's right, and we wanna have that walk-in closet for mom with all of her shoes, and dad needs this and dad needs that, but really intellectualize this process and really understand and be proactive, like Sandy was saying, what your options are. Reach out to the Alzheimer's, talk to Jonna, talk to me. We've all talked about all these different resources that can help you, but get those things in line and it'll make this journey so much less stressful. It's always gonna be stressful.
I wanna add to that, I mean, amen, but part of it is you are not gonna be able to help yourself but second guess everything you do.
Right, yeah.
Because with the ups and downs, when they're having a good day, you will sit there and rationalize. It's so hard to wrap our own brain around, so to speak, the fact that their brain isn't working. We can relate to like if somebody has pneumonia or stubbed toe or whatever. But somebody's mind deteriorating is so hard to really embrace. It just doesn't make sense to us. And so when they have a good day, you're gonna second guess what you're doing, and then they'll have a bad day and you're like, oh yeah, I need to get these things done. So that's why it's awesome to have people like this that can kind of help keep you grounded, and you need to have the support because you are going to constantly second guess yourself, even after somebody's, you know, like when my mom was in a memory care unit, you know, I couldn't help myself because my mom was so intelligent. I'd be like, oh, she's gonna snap out of this, she's gonna be fine. And that's what I would be doing, talking from my heart, that when I put my brain in it, it's like, no, this is a disease, it's going to get worse. It's so hard not to second guess everything you do, so you really need to get support for yourself as well. Whether it be a friend, a loved one, Alzheimer's Association, something, but you need support because you are going to drive yourself insane, second guessing what you're doing.
Betsy?
One of my experience, I took care of my mother-in-law with her dementia until her last moments. But something that I found out is that her daughter, my sister-in-law, had a lot of this guilt because she thought she should be the one taking care of it. Why she was not patient enough, or she was always on the set. I always told her that I was going to tell her the truth, though she wanted to fight that this is not true, I told you, we decided that, or something like that. But the added layer is that you have a history with your family member, and there's hurt, there's memories that you do keep, even when that person forgets. And it's harder on you, and this is the conversation I had with my sister-in-law. I am not a better person, I am not a better woman, that I am more patient with your mother, or I have more, ability and time to do this for your mother. That doesn't make me better. It's just because I don't have the history that you have with your mother and the stories and the suffering and the years that you were fighting with each other. That is really in your heart and in your memory, even if she forgot. And it's okay to let me take care of it because I don't have that I don't have those pushing triggers that, you know, words that she used to say to you that drove you crazy. I don't have that because I met her when I was a grown up and, you know, I fell in love with her. But that doesn't make me a better person. So when you're making decision and somebody else could take care of your relative better than yourself, doesn't make that person better. It's just they don't have all of that history of all of that feelings that you do remember, that you had lived, and they're true and they're valid, you know, valid that, you know, certain words, certain comments, you know, like, you know, where did you get that baby will hurt you, but another person won't because we don't have that history, we don't have that thing. So that was one of the things that it helped heal and to really carry her into her last days without too much conflict or guilt on, you know, in this case, her daughter being the only daughter, that she thought she had to take that on her own and couldn't understand why she couldn't.
Yeah, there was a lot of time. I heard Betsy spend a lot of time with her sister-in-law. Like, her sister-in-law would be just like, why can't I do what you do? Why can't I be the person that you are? And that's that comparison that we need to stay away from, because there is a lot of feelings, a lot of emotional guilt that comes with it. So I think having support is huge. Yeah.
There's another resource that I wanted to share with you all. There's a expert nationally known in the field of dementia. Her name is Teepa Snow. It's Teepa Snow. Teepa Snow. She has a fantastic background and experience in dementia. Her website has a lot of educational videos and learning resources. I've had the opportunity to hear her speak as a keynote speaker a couple of times, and she's just very easy to relate to and understand. She just has a depth of experience. So I would suggest anybody who has you know, family members with dementia, whatever stage that is, Teepa Snow is a great resource to look up online.
Dave, are you familiar with communities in the area that practice those types of best practices that Teepa recommends?
There's
Okay.
definitely.
Yeah, I didn't want to say, look for a community that practices her best practices. Without, you know, like, what do you? Good.
I will also add, there's Joy's House is technically an independent adult day, but they have a website called Caregiver Way. It's not dementia specific, but it's all focused towards caregiver resources and support. Also, the Alzheimer's Association just came out with an app called My Owl's Journey. It's an app that kind of helps walk caregivers through the journey, you know, the progression, things they should look at. It also has a counterpart for somebody in early stage dementia as well, to help walk them through different ways they can help support their brain and their health as well. Really, really great new resource. Really recommend both of those. And if you ever have the chance to meet Tina from Joy's House, she's truly, truly a gem.
Amazing. Yes.
Yeah,
good. I'm gonna open it up for questions.
Dave, how many assisted living locations locally are there?
Boy, like you mean Hamilton, Boone, Marion County, kind of around there.
Boone County.
Boy, I would say there's probably 75 up to 80, yeah, different levels like that, yeah. They all do a little bit different. There's no standard for assisted living other than following the licensing, but within that, some might do a higher level of care, some care stops here, some memory cares are 12 residents, some are 40, you know, it's all a very nuanced approach to
Is
what
there
they
a
do.
listing of them anywhere?
I could help you with that. I mean,
In your
yeah.
office?
Yeah, I mean, what's unfortunate that, you know, the internet's great, but you can search that and you'll get a lot of, well, oh, that's just a 55 or older community and they all, you know, it's kind of hard to look that up. But yeah, we'd be happy to talk to the engineer about that, sure.
It's just, like Dave mentioned, he's essentially like a realtor when it comes to the communities. He knows the insides and outs of them, and we like to do things on our own. So I understand the question, but I'm also kind of getting to a point in my life, if I can find the expert that can take me to a certain place, I'm gonna use that resource for time purposes. So, yeah.
This is kind of a two-part question, but Dave, do you have a consultation with people at their house, or do you have a video conference with them?
Whatever's easiest, I'm happy to come to you, and yeah, I like to sit down in front of
Yeah.
people whenever possible, but a lot of times, you know, families call me and we start the conversation, and then really the first time I meet them is, you know, on the first tour. But I like to just talk and say, hey, this is my process, and share, you know, examples and things like that. So yeah, whatever works.
So if in my case, if my parents are resistant to going to like a multi-tier facility,
Right.
and they really are like, well, maybe we'll do this, but we have to do independent, like we need to do independent. Like they just, even though, quite honestly, my mom should at least be an assisted, and my dad is in his 80s, so he's struggling to a certain extent, but still wants to be independent. I'm not sure which group would be the best at advising how to point them in the direction of like, oh, that's good that you're thinking about this. Maybe assisted would actually be better because they're not accepting that advice from me, but I'm also excited that they're at least starting to look at options.
Yeah.
Like, is there a group that would, like, would it be you that, like, if you went to whatever place with them and they're like, yeah, this is great, but we really need to do the assisted side, would you, is there a way to help direct them into the appropriate,
So, I'll try to answer this two different ways and tell me if I got it right. So we can, I tour a lot of times with the kids without the parents, so that is something to kind of where we can go out and have those conversations and look at communities and kind of strategize like, hey, is mom gonna push back on that, or is this gonna be a problem for dad? How should we frame this differently, and kind of come up with a game plan?
Yeah.
And then at that time, if you wanna be the expert and you feel you've got to really kind of roll it out to them, or I can get involved and then we go tour, that's perfectly fine too, because yes, sometimes they'll take it differently if it's from somebody else other than you.
Right.
One of the first early tours I did, there was 3 sisters involved. One was kind of the leader of the group, and she connected with me, and I was sharing with her all my spreadsheets that I have, and she's like, oh my God, this is awesome. So then we went and toured with her sisters, and then we kind of put a game plan together, and then she rolled it out to her dad. Not so much that mom needed care and dad didn't want to leave the house, but she took all that information because he had a financial background. She laid it all out financially. It was like, Dad, working with this guy Dave, he's great. You know, Cindy and Sarah and I, we've gone out and toured. Look at this. We could move into this place and you could totally afford this and it's going to be great. It was just that was enabled to get him to go tour. He was like, oh, well, I didn't think that I could afford this. This is great. So now we got him on board. The reality was he's totally independent. Mom needed a little bit more support, but through that process, he dug his heels in and he was like, I want to be an independent living. But we moved him into a community where everybody was under the same roof. So it had a little bit more of a mix. It didn't have that maybe acuity that comes with assisted living. He felt comfortable. The girls were like, hey, at least we got him this far, and we'll just cross that next bridge when they need assisted, when we have to cross it. But boy, this was monumental just to get him here. So that's perfect. So that's one way to strategize.
It's better to at least take a step into a campus that could support them longer term. And it could be even a month after they move in, they'd have to move again, but at least they have a little bit of familiarity.
You're on that path, right? Yeah.
Dave, do you find that a lot of people, because I found this with my mom and her husband, that especially at their age group, there's a stigma.
Oh,
that
sure.
They think it's gonna be this dilapidated, horrible, awful nursing home with terrible food, terrible light, all this stuff. And then when we took them to tour a couple places after my husband and I did our, work behind the scenes, we took him to one place and my mom, of course, was like, I don't need this, but her husband was like, heck yeah, let's move in.
Yeah.
How
Because
many
it
of you
was
toured
right.
any communities? Can you raise your hand so I can see? Okay. All right, open it up. And then, can I ask how many dread the process of looking at
The what?
tours? Just kind of dread.
Dread the process.
Okay. Alright.
I wanna mention that,
Dread it? Yeah.
I
Question.
wish, my wife and I had you folks available when we had to take, our parents or move them into assisted living and independent living. We did most of that on our own, and it was stressful, but it worked out fine, and, this was during COVID, which was even worse.
Yes.
And, but really, I would have really appreciated to had a lot of help like you folks are doing now.
And I hear a lot of times that, the daughter, and thank God for daughters. If it wasn't for the daughters of the daughter-in-law, I wouldn't have a job. Sons never reach out, I hate to tell you.
We know son. Bob is a doting, passionate son, so I'm gonna give him a shout out, because he's the boy back there.
There are so many emotional parts of this too. It is where they want to remain independent. They also don't want to often use the assets that they have, because they have this feeling that they have to transfer these assets to their children. And I run into that conversation all the time with my mom. I want the best for my mom. There's nothing that my mom's going to leave me that's going to be life-changing. Her departure will be life-changing. So I want her to spend that. And so it's this constant conversation. But what we do spend a lot of time on is we focus on making memories. And so that part's very important. Dave had mentioned it earlier, and some others mentioned as well. There's such stress on the caregivers, and that is not a memory that, I don't want that stress. And I find people that can help with that stress. There are better qualified people that can help with my mom's therapy than me, and that stress, that burden. I also like when someone else can be that bad guy too. There's things that other person can say to my mother that I can't get away with. She might be an almost 80-year-old Italian mother that's 4'10" that tells you she's 5'8", that is still not afraid to slap me if I get out of line. But it's nice when someone else can be that bad guy and tell her what she needs to know. She doesn't want to hear it from me. And so it's nice, and it does take that stress off. And sometimes I can be the hero too and step back and, well, he probably could have said it a different way, Mom, but you do need to eat, and you do need to drink, and you need to do these things. So I focus with my clients on making the memories, not the mortgage payments. And what I do want to mention as well, kind of put Tara on the spot, is in other conversations that we've had, you've mentioned, because Sandy brought it up really, where her mom was, I couldn't hear you. And if you could just briefly touch upon the hearing loss and how that is such an early indicator of onset dementia.
Yeah, so there's a lot more studies nowadays about the impact of hearing loss on our brain and the progression of dementia. So we talked with an audiologist a couple months ago, and the way she described it is that when you have hearing loss, your brain is going to prioritize hearing because evolutionary or whatever, you need hearing to do a lot of things. And so it may take from assets in your brain that it deems less important, which could be your memory, some of your cognitive functioning. And so your brain's putting the resources into keeping your hearing as functioning as it can. And then, once again, if you don't use it, you lose it. Those parts of your brain that are memory and cognitive functioning may not be being used as much because your brain's trying to prioritize your hearing. And so that can also, sometimes, I don't want to say lead to dementia because there's a lot of different causes of dementia, but it could, further the progression if you may already have it. Because once again, your brain is taking the energy from those vital parts of memory and cognitive functioning. But also treating hearing loss early can also reverse that. Your brain is very, it's very adaptable. And so if you are treating your hearing loss early, it can potentially fix some of those symptoms you may have. I want to say potentially, it's going to depend on a lot of things. But that's why it's really important to you care about your brain, care about your cardiovascular health. Hypertension and diabetes are some of the major risk factors for Alzheimer's and dementia. Physical inactivity as well. I always make this joke, I'm sure Rock's heard it like 7 times. Physical activity is super important, but you don't have to run. I say if I'm running, you should run too, because I'm being chased, okay? I'm not a runner. But doing anything to kind of keep your blood pumping is good for your health, and that is across all ages. This does not stop by the time you are 65 and you don't have to care anymore. This also doesn't stop if you have dementia. Keeping your brain active, keeping your body active, is now, more and more studies are showing, it can slow your progression. The US Pointer study came out about a month ago, saying that individuals who keep themselves physically active and eat well, their brain active, do puzzles and stuff, they actually had a cognitive age 3 years younger than they were. And this was a study done on, I believe, 55 plus. So they had a younger cognitive age than they actually had presented. And so it's kind of showing that these habits do have a really big impact on our brain, not just your current health, but your future health as well.
Yeah, it's like use it or lose it.
Yeah, use it or lose it. That's our slogan for the day. I'm gonna go with Nancy and then Rob.
I'm glad you brought up about hearing. I went for a hearing test last week, and I figured out that I need to go every year, just like eyes or teeth or whatever. And I noticed this time that I had to really focus and concentrate during the test to hear, well, you know, the tones. And I passed it fine. But if I hadn't really been paying attention, so that what we said, the connection between your brain and your ears is a big deal. And I've got hearing loss and dementia in my family, a couple generations worth, so I'm really happy that I can still hear without a hearing aid.
But those hearing aids look great. I was gonna speak to Betsy's husband. Did you hear her say that paying attention to your hearing early is
Oh,
good?
sure.
Because her husband had hearing aids. It was he's young and handsome, and they fit quite nicely. But you were a little bit worried about his hearing problems, having had been early in life. But to hear Tara talk about how it could reverse or paying attention to it at a young age is encouraging now, I feel like.
Yeah, he was becoming very anxious person, socially anxious.
Yeah.
And I didn't understand why. I knew he was shy, you know, I met him and he was Bambi, you know, he looked at me and said hello and kind of hid himself, you know, his head under his hat. But it was getting to a point that even going through drive-through was creating anxiety, and I didn't know what was going on until we had to move. We had guests in my house. I always have guests in my house. And we ended up in my daughter's room because we shuffle, you know, fitting people everywhere. So there was crickets in her room because her window goes through the garden. So he was like, "Oh my goodness, can you hear that cricket?" He's like, "They're inside." And he walked in and like, "Can you believe this noise?" And he's like, "What noise?" He could not hear at all of the cricket racket. And then I said, "Oh," and we went immediately. You know, I made an appointment for him and I dragged him. "You need to get this tested." He had lost so much hearing that we didn't know, and it had to do with the understanding of speech. And he was after COVID, he was doing online working. So all of his work was through a phone or a Zoom, and he was getting so frustrated because he thought he was getting dumber because he couldn't understand what was going on. And that was getting him that all of the anxiety. But since he lost it gradually, he didn't know that he was not listening. He was not hearing well. Then I was not thoughtful enough because I thought, you know, you need hearing aids. Like now you need glasses, so go ahead and get it. I was not very sensitive to understand that he was going to, you know, it's a stigma, you know. I remember my great-grand-uncle using those hearing aids and he was awful, and I was not very nice.
She's like, "Problem, just fix it.
Just fix it, go get him." And it took him a while, and then I said, "Oh, I'm sorry, I didn't know he was that sensitive or whatever." But he ended up, and now his personality is changed, and I wonder if we would have waited for so long that, like you said, his brain would have been locked in a way that it was harder for him. And his mom was the one with dementia, so I started freaking out about that too.
This gentleman,
Yes.
I yield to this handsome gentleman right here.
It's Fenway?
Fenway, yeah.
Thank you.
I have been a sales director in the facility before, and I've worked with Dave, so I just want to talk about being on the other side of it, because what Rock said of like, being a caregiver is there's so much pressure, there's so much that you're processing through, so actually having Dave like there as a sales director, there'd be things that I would forget to talk about, but Dave knew about my facility that he would bring up or be able to remind them you know, this facility has this one does not. So it was like really helpful, for the people that I was sitting down with too, so. If you're considering that, going that route, it's really helpful.
Well, I just love just the personal attention he was able to give Andrea, like to just sit down and get to know all the important people, the memories, what's important, and then come up with a plan. I mean, just is worth it.
That's right.
Miss, oh yes.
Do you have a twin brother that works in Hendricks County?
Do I?
Yeah.
No, I don't think so.
If my brother would need help for Hendricks County.
Oh, I think you meant I look like somebody. I'm
Oh.
sorry. Oh, okay. Yeah, no, I can go to Hendricks County. Absolutely. Yeah, absolutely. Yeah, thank you.
Thank you for being here.
So I just want to talk about this step before we get to Dave, who I recommend Dave all the time, is that downsizing. And what is exciting to see within Indiana is the communities now that are geared towards my age and older. So there's this downsizing step, and these communities now are very active communities. These are not retirement communities. These are people, like at one community, I happened to stop by and was talking with their concierge, right? This is an association of houses, it's an addition. And what they were telling me was that the lifeguards, who are young kids, do not know what to say to folks my age and older who are drinking in the pool. These are 80-year-olds, and they're like, you can't bring this in. And how do they reprimand grandma and grandpa for this? But we talk about the activities. These communities now are embracing this lifestyle. People can't wait to move in there, and helping many of those people, finance the homes in there. You talk to them later, they're having a blast, as opposed to living in the homes that they are no longer fit for them. The two-story homes that they raise their kids in with the big yards. They do want the homes that have the lower maintenance. They do want to be able to, see their neighbors. They do want to play bocce and card games, and they're staying more active. And I think that's a big change that we're seeing. And Indiana's finally getting there toward these are lifestyle communities, not retirement communities.
Very much the lifestyle community, very purposeful in getting us out of our homes with our two-car garages and into activity and engagement.
And then what they're doing as well is oftentimes, like with my clients, they don't need all the money to go into these new homes. They have these other assets that they can use, to the point that was mentioned by the nice lady here in the back. Then you get that independence and the concierge service. I need someone to come in and help me with my physical therapy today. Great. Or I need someone just to come in and help me. And there are services like this, which are amazing. There are services where people will come just to your house or to your parents' house or your loved one's house, just in the morning, to make sure they've had medicine, to make sure that they've eaten, to make sure that they've showered, to make sure that they've had the social contact. And when I hear how much they're charging, I'm thinking, that's ridiculous. You guys need to be paid more, because what it does do is, for the adult children, they're not having to run over early in the morning to check on mom.
Yeah, then there's non-medical home care, home providers. So that's what I feel like I'm learning, is all the different services that are available to us that we didn't even know were out there. Yeah. Judy.
I just want to say that we did meet with Dave a couple weeks ago, and prior to meeting with Dave, we're both healthy right now, but we've gone through Hoosier Village, we've gone through the Barrington, we've gone through Traditions with Dave, and we've gone through the Stratford. And I just think it's amazing, you need to go. You need to do all of them. Dave was great to work with. He simply met with us on the phone. I've talked to his secretary, and they ask you, what are you looking for? What do you specifically want? My specific request was a screened-in porch. Difficult to find, but he found one. So going around it, and just like you said, there are so many activities and so many things for, like, if we were to go, we would enjoy all of that. We wouldn't be going in there when we couldn't use it. So I can only say how I think you just really need to go visit these places, whether you're ready or not. You're going to be ready someday. And it's better to have it in advance and know. The only thing I will say is the prices have gone up immensely since we started looking. So if you're thinking about it.
Did you get on any wait lists?
Pardon?
Did you get on any wait lists?
We've been on a wait list at Hoosier Village for 5 years.
Yeah.
the wait list
Yeah.
that we went over at the
It's that
Barrington, there's
string of works that you
87
want.
people ahead of us. Yeah, so, it's, yeah, I mean, you're not gonna go in and say, oh gee, this sounds great, I'm gonna move in today, it's not gonna happen.
No, you have to,
It's not gonna, unless, you know, you got a lot of money, but.
we've got the 65 and older, how many years to by 2030? There's gonna be a huge population of
Yep.
65 and older, and the wait lists are not gonna get any shorter.
No, and the prices are gonna keep going up.
Yes.
By 30 or 35, for the first time, there's going to be more individuals 65 plus than 18 and younger. If that just kind of shows how
Yeah.
the prevalence of the need.
Mike and I have a weekly meeting at an assisted living place, and I had no idea what this was like. And I've gotten an idea, so around March, we have March Madness, and was talking to the person that is one of the directors. She calls herself the cruise director. And I said, well, I'll stop by, but I got work. Well, just bring your laptop, you can work. Well, this is March Madness, this is at an assisted living place. I thought I'd be able to take my laptop in and sit, because it would be quiet. There's nothing but people there. There were people shooting basketballs, there was a margarita, there were pictures of margaritas, there was bourbon tasting, there were games on the table. It was loud and crowded.
It was
and
10 in
these
the
people-
morning, right?
Yeah. They all have happy hours.
This was not what I expected, and Mike and I see that all the time.
No, it's definitely, it's opened my eyes tremendously, and they've got an event coming up on 9/11 where it's their football kickoff, so that's the next event coming up. And people come in from outside and you interact with folks, and it's just like, again, if you could think of a dorm or college and atmosphere, that's what these people are going through. I'm like, well, who wouldn't want to be involved with this?
That's good. Well, I thank you for all of your questions, and I want to thank our panel. You guys are amazing. Thank our educational partners for being here. They're such a resource.
So, are you trying to take a picture of that transitioning thing? I'm gonna lower the light so you can take a better picture if you want.
Actually, Dave has a much better one. So I'm actually just, if you don't mind, gonna let him see Dave before you leave. He has a much better, I don't,
Isn't this one?
Assisted living.
Oh, that?
yeah,
Yeah,
yes,
okay,
yes,
yeah.
that's one, yeah. This is, I think more updated and current, so I stopped by and take that. There's definitely different levels of care. And, just wanna also point out that it's not a one and done. You may make several transitions just like we do in life. So when that happens, I mean, Jonna is the one that I called him to move on, just because she's gonna be doing it in a loving, careful way. So, all right. Well, thank you guys. Stop by and see your partners. See you next month. Please fill out your surveys and leave them in your seats.
We'll be here. What do you need? That's why I have to. That's what my
So the other
So for you as a youngster, it's sort of like, did you open any eyes or I'm not knocking on the floor, but they're just
Yes, Guatemala. Mi mamá se casó con un puertorriqueño hace muchos años. No le alcanzaron las patas para salir corriendo, pero mi hermana, mi madrastra, diría, stepsister, es mi hermana de mi corazón. Por eso vamos mucho para Puerto Rico. ¿De qué parte de Puerto Rico? Okay. Más en la montaña. Sí, varias veces, sí. Mis hijos han ido más a Puerto Rico que a Guatemala. But because it's easier, faster, and you have the beaches there.
I'll do this out.
Mucho gusto. Qué bueno que vinieron.
en el caso de nosotros, recién se mudó de y estaba con stroke en 2004. Somos hermanas de yo fui la primera en el 2004. Él quedó paralizado todos los 4 meses. Mi mamá era y ella hizo pero ella decidió ¿qué pasa? Entre medio de todo eso, fue mi suegra que le dio pues ella no tiene grave, ella lo de lo más claro. So, me ayudó, hicimos la mudanza de ella de 60 años después. Sí.